My name is Stephanie and I'm a clinical pharmacist in the atrial fibrillation clinic. One of my main responsibilities is to ensure that patients are on optimal medication therapy. I do some medication titrations for patients to make sure that the patients are getting the most out of their medications and not getting side effects, so they're tolerating the medication therapy okay. Ensure that they're on monitoring blood work to make sure that the medication therapy is still safe for them in between the clinic visits. I am also involved in research projects where we look at quality improvement factors and try to improve the care that we provide to our patients. And I also do some teaching for pharmacy students and residents as well. The greatest thing about working in an outpatient clinic as a pharmacist is that we're able to follow up with them after they leave the clinic when these therapies are started to ensure that the medications that they're using are still as safe and as effective for them.
We've had a lot of really amazing pharmacists in that role in the atrial fib clinic since it started in 2009, and they've all been amazing. But Stephanie is just a little bit of a superstar in her own right. I call her the Steve Nash of pharmacy because she just goes about being excellent quietly, just like he did in basketball. She dedicates herself to patient care completely. She spends many hours here after the clinic is closed, making sure that everything is perfect for people's INRs for procedures, that any phone calls she's had from patients are answered. She is tireless in making sure everything is safe and that people understand what's going on.
Stephanie has just risen above and beyond and stayed on top of research and the latest policies and clinical practices, and has just really been pivotal in moving the clinic forward.
I looked around me and I always look at people who work quietly and independently, but also is a key member of the team. And that encapsulates her. She's always there for the patients, even for patients that are not a part of the clinic.
When we have people in the pacemaker clinic that have questions about their medications, or we have questions about them, she never says no, even though she's not our pharmacist. And we'll go and research things for them, print out teaching sheets for them, give counseling for them, even though she's spending her time in the AFib clinic full time. She's just someone I regard most highly, and I think she's so deserving of this award. Just so easy to work with and so charming and so knowledgeable. Truly a hero for me.
She's definitely the unsung hero. That's what she is. I have nothing more to say, but that is exactly what describes her.
I feel very grateful that I work with such an amazing team. Thank you for nominating me this year, and it just serves as a greater motivation for me to continue doing what I'm doing.